For healthcare professionals, including dental personnel, effective hand hygiene is critical for reducing the risk of transmitting organisms. Clean hands protect you and your patients. Hand hygiene is a general term that applies to routine hand washing with water and plain soap and water. Hand washing with water and an antimicrobial soap, cleaning hands with an antiseptic alcohol-based hand rub, and surgical antisepsis, using water and an antimicrobial soap or water and non-antimicrobial soap, followed by an alcohol-based surgical hand scrub product with persistent activity. In keeping with infection control procedures in the dental practice, avoid wearing jewelry, including watches. Keep your fingernail tips trimmed to about 1/4 inch. They should be neatly filed with no sharp edges. So when should hand hygiene be performed? The U.S. Centers for Disease Control and Prevention, or CDC, recommends that hand hygiene be performed before and after treating each patient. In other words, before putting on gloves and after glove removal, as well as following ungloved hand contact with a patient's intact skin. Before leaving the dental operatory, after touching contaminated objects, when hands are visibly soiled, after removing gloves that are torn, cut, or punctured during a procedure, and before you replace damaged gloves. When handling contaminated instruments for instrument processing, always wear utility gloves. Never use bare hands. What products can be used? For routine non-surgical procedures, hand hygiene can be performed with plain soap and water, an antimicrobial soap and water, or an alcohol-based hand rub that has an alcohol concentration of 60 to 90%. If your hands are visibly soiled, they must be washed with soap and water. First, wet your hands and apply a small amount of liquid soap onto one palm. Rub vigorously until lather appears and continue rubbing for at least 15 seconds. Scrub between your fingers, under your fingernails, and the back of your hands, as well as the palms up to your wrists. Then, rinse your hands under running water. Dry your hands completely with a disposable towel. If the faucet doesn't have a foot pedal or automatic shutoff, use the towel as a barrier to turn off the faucet. To clean your hands with an alcohol-based hand rub, check the manufacturer's instructions for how much of the product you should apply. Some manufacturers simply state to wet hands thoroughly with the product. Dispense the alcohol-based hand rub on the palm and rub your hands together, covering all surfaces and fingers until your hands are dry. If your hands feel dry after rubbing them together for 10 to 15 seconds, you most likely have not applied enough product. Is soap and water better than an alcohol-based hand rub? According to the CDC's recommendations for infection control in dental settings, either product can be used for routine hand hygiene, provided that there is no visible contamination on the hands. Alcohol-based hand rubs that have an alcohol concentration between 60 and 95% are more effective at killing germs than those with a lower alcohol concentration or non-alcohol-based hand sanitizers. Also, while alcohol-based hand rubs can inactivate many types of microbes, they must be used correctly to be effective. Alcohol-based hand rubs are useful when hand washing facilities are not available or feasible. For example, when you are working in a mobile clinic, doing routine dental screenings in a school, when there is a boil water advisory from your water supplier, and when hands are not visibly soiled. Alcohol hand rubs are also helpful for reducing skin dryness and irritation. Regardless of which hand hygiene product you use, hands should be completely free of moisture before you put on your gloves. Dry hands help reduce skin irritation. Good hand hygiene practices combined with wearing gloves are essential elements of infection control. And effective hand hygiene protects you and your patients. For more information about the ADA Professional Product Review, visit www.ada.org/PPR.